Greetings from the Bureau of Primary Healthcare's Office of Health Centers Investment Oversight. This video will address requirements and tips related to tracking and monitoring Health Center Program Supplemental Awards. This should be a great resource for a variety of audiences. As you know, each grant award has distinct requirements, objectives and outcomes, and allowable costs. Part of your responsibility as a Health Center Program awardee is to ensure that supplemental award activities and their related expenditures comply with the requirements, terms, and conditions associated with each specific award. A few years ago, HRSA started issuing Health Center Program Supplemental Awards using unique activity codes to help health centers track the supplemental award activities and expenditures distinctly and separate from the Health Center Program Award. Let's start with the basics. The Code of Federal Regulations requires that awardees must have an adequate financial management system in place that can accurately manage, track, and report on federal funds. Specifically, your financial management system must be able to separate awards by funding source and account for all funding separately in the general ledger. Awardees must maintain timely, accurate, current, and complete disclosure of the financial records of each federal award. Your financial management system must be able to identify the source and application of funding. This will help ensure that federal funds are not commingled with other funding sources, and to compare budget to actual expenditures. Tip: the Health Center Program Compliance Manual, Chapter 15, details financial management requirements applicable to Health Center Program awardees. Your Health Center Program awards should be tracked separately in your general ledger and chart of accounts. Here is an example of a general ledger with multiple awards. You can see that each HRSA grant has a unique code. This particular software allows for reports based on various criteria and filters. The result is a complete separation of grant funds. You can see here the cost associated with the HRSA Virtual Optimization Grant. Tip: internal controls should ensure expenditures on grants do not exceed the approved budget total and prevent duplicate charges to multiple grants. Now let's review some Health Center promising practices in this area. First, ensure fiscal reports to the Board of Directors includes information for each of the Health Center supplemental awards. Next, build cost projections or forecasting into your financial planning to ensure spending is on track based on the award's budget. Another promising practice is to offer ongoing trainings to your fiscal and program staff on grants management policies and procedures. Here are a few more promising practices. Schedule recurring check-ins between fiscal and program staff to discuss grant status, key expenditures, and any changes needed. Another promising practice is to invest in accounting and payroll systems that streamline tracking of staff time and effort and allow for source documentation. Finally, seek out trainings on grants management and federal financial management requirements such as those offered by your Primary Care Association or the National Association of Community Health Centers. Maintaining adequate supporting documentation is critical. The number one reason why HRSA requests return of federal grant funds after an audit or grant review is lack of adequate supporting documentation. Proper documentation helps support that grant costs are allowable, reasonable, and allocable to the award. In addition to the allowable costs specified within the NOFO, to be allowable, costs must fall within the grant period. To support reasonable costs, maintain cost comparisons and bids. Your financial management system will help show how costs are allocable by using cost centers, fund type codes, and other identifiers in your software in the general ledger. So, as we conclude our video, let's highlight why tracking Health Center Program Supplemental Awards is so critical. First, it will help you to track personnel costs that are charged to multiple grants. Second, tracking supplemental awards separately will help ensure that costs tie back to the HRSA approved budget for each specific award. It should also help prevent commingling of funds. Tracking awards separately helps you ensure costs are allowable for the specific award. It can help you reconcile award expenditures with withdrawals from the payment management system. Finally, tracking supplemental awards separately can help you comply with HRSA reporting requirements, with audit requirements, and other inquiries. In sum, tracking your federal awards separately helps you stay compliant with federal requirements. Thanks for watching. For additional information on how you can successfully manage your federal grants, check out the resources in the description section of this YouTube video. If you have fiscal questions about your awards, reach out to your grants management specialist on the notice of award. If you have programmatic questions about your award, use the BIPIC contact form and your question will be routed to the specialist within BIPIC.